Good morning, everybody. Welcome to our what has become our monthly virtual town hall for the Boston Marathon and Jimmy Fun Walk presented by Hyundai. I'm very excited to have all of you here today. For those of you that I haven't met, my name is Zach Blackburn. I am the Assistant Vice President for the Boston Marathon Jimmy Fun Walk, and really excited to welcome you all. Thank you for joining us for the next 45 minutes or so as we provide some updates on Jimmy Fun Walk Your Way for 2020. Introduce our new Jimmy Fund app inside of Charity Miles. But before we do that, I want to introduce our first guest. Let's not waste any time. We are really excited to have Dr. Jeffrey Meyerhart with us today. Dr. Meyerhart is the co-director of the Colon and Rectal Cancer Center, the Douglas Gray Woodruff Chair in Colorectal Cancer Research, the Associate Director of Clinical Trials for Dana-Farber and Harvard Cancer Center, the Deputy Clinical Research Officer of Dana-Farber Cancer Institute, Professor of Medicine at Harvard School of Medicine, and if he has any more time left, he is also a 2-star pace setter with Team GI. So we are really excited to have him join us. And I'm going to turn it over to Dr. Meyerhart. He's going to talk for about 10 minutes or so and give some insight on what's going on in the front lines of Dana-Farber, similar to as we've done in the past for the last couple of town halls. And if you have any questions that come up throughout Dr. Meyerhart's talk or anything that we're doing, we encourage you to use the chat functionality, Q&A functionality on your screen, and we will get to as many questions as we can at the end of the session. Dr. Meyerhart, thanks for joining us, and I will turn it over to you.
Thanks so much, Zach. So I realized when I put this shirt on, I came down and saw that they were going to have this screen that it might look a little goofy, but I am part of Team GI, so I thought it was appropriate to wear the shirt. And thank you for all of you guys for joining today in this virtual webinar. I'm going to talk a little bit about myself. The team asked me to talk a little bit how the Dana-Farber has been adjusting to the situation for the past 4 months and how patients have been cared for, and I'll talk a little bit about the research studies that have been going on, and then I'll talk a little bit about a study we're doing actually to help understand a little bit about COVID, or 2 different studies, and then close off so the other items can get to. So as Zach said, I'm at the Dana-Farber. I'm a medical oncologist. I think that sort of all those things listed here, I actually think I still think of my primary role as to treat patients as a medical oncologist within GI cancers, so esophageal, pancreas, colorectal, and other cancers of the GI tract. I've been at the Dana-Farber actually 20 years now. I did my fellowship there and on staff for the last 18 years. In terms of research, what I do research, both epidemiology research. I actually look at lifestyle factors, diet and exercise and other things, and how those affect patients with cancer, particularly colorectal cancer. I also do a lot on the clinical trial research, particularly now with a large organization through the National Cancer Institute, where we work on large trials in phase 2 and phase 3 trials for patients with GI cancer. So I'll talk a little bit about how kind of things have been going at the Farber for the past 4 months. It's hard to believe we're already 4 months into all this since mid-March. One of the sort of priorities since day one was to continue to provide the care patients needed and make adjustments to be able to care for patients, as well as make it as safe as possible and reasonable to reduce patients' risk related to COVID-19. And so we've never closed. We fortunately have a little bit of a different situation than the inpatient facilities, though there's a Dana-Farber hospital within the Brigham and Women's Hospital, and then there's inpatient beds within the Brigham and Women's Hospital, of which we had redeployment of some staff as well as some of the physicians to help with teams in the inpatient setting. But fortunately, a little separated out, as everyone knows, is the outpatient setting. So we were able to continue to care for patients and do the treatments that are necessary for patients throughout that. There were discussions that physicians had with patients in terms of their chemotherapy choices, if there were alternates that may affect their bone marrow less and not cause as much lowering of their immune system. There were considerations, should the patients take treatment breaks. We rapidly were able to stand up virtual visits that sort of happen around the country, but we, within weeks, was able to have virtual visits. And for a period of time, 50% of visits were virtual with patients. And the patients that were appropriate for virtual visits were patients, for example, on oral chemotherapy, or patients who were coming for follow-up several months at the end of treatment to see how they were doing. And that actually we've continued to do. It's about 30% of visits right now are virtual. And I think they've really worked out great for patients as well as providers. We'll sometimes have patients go and get labs locally so they don't come into the FARB. Some people choose to come to the FARB for those labs. And similarly, initially we were having more, if they needed a CAT scan or an MRI or something locally, we've more of those are happening now at the FARB. But there's, again, it's a discussion on what's comfortable for patients who don't need to physically come into the building, what would be the best for them. We've rapidly reduced how many people are in the building. So initially all the what we call wet labs or research labs were closed. They fortunately have been able to start up, but there's still a really controlled reopening to reduce the amount of people in the building. So for people who are there, they feel safe and they're not crowded in different spaces and in the elevators and things like that. It has led to, we have currently a no visitor policy, so patients have had to adjust and come in on their own, with some exceptions for patients who really need a family member or companion for various different needs. We are adjusting that starting next week, that a patient who's a new patient who's never been to the FARB will have allowed a visitor during that new patient visit. But it's been certainly challenging to patients, but actually a lot of my patients appreciate in the fact that when they're in their waiting room, they're very spaced out from other people. They feel comfortable being in the building. Everyone wears masks, as hopefully everywhere in Massachusetts and inside spaces, but we've been doing that since late March. And again, there's sort of reduced number of people in the building. And so again, I think that we've been able to continue giving the care that we want to give to patients. We've had to make some adjustments. So for example, social workers will work with a patient virtually, maybe not the same day as the visit, but a different day. Nutritionists and the other support service, the Zachem Center has been able to do a lot of the programming for complementary therapies virtually, both exercise programs and Reiki and yoga classes. They've been able to stand up virtually, which I think has really been helpful to patients as well. On the research front, on the clinical research front, we never had a period where we totally shut down clinical trial research. And patients who were currently on trials, nearly all stayed on trials as they stayed appropriate for them. There were very few patients. We actually recently collected all the data, and it was only about 7 total patients that came off of trials specifically because of COVID-19. And again, we were able to continue to enroll in a lot of the clinical trials for the entire last 4 months. There were some trials that unfortunately we had to stop enrollment for a period of time because some trials required you to get a biopsy to understand a little bit more about your tumor to make sure it was an appropriate trial for you. And because of some of those services at the Brigham where they were having a really high patient load at the time, some of those things we had to put on hold. But now, fortunately, we've now been able to ramp back up that really all those opportunities are now available to patients to be able to go on trial when appropriate for the patients. We've done, in terms of research related to COVID, there's several efforts that are made by the Dana-Farber faculty that are really pretty interesting. So there are participation in multiple of the therapeutic trials specifically for patients impacted by COVID. There's repurposing of some drugs that have actually oncology indications where there were observations that a patient who were on those drugs may have done better who were infected. And so that has led to several trials that continue to be ongoing to look at potential therapeutic opportunities for patients who do get infected with COVID. We have two studies sort of understanding the course of COVID. So I'm leading a study looking at antibodies. So people probably have heard a lot about antibodies in the press, and there's a lot of sort of to still learn, what does it mean if you have antibodies? Does it mean you're protected immunity-wise? Does everyone develop antibodies? How long they last for? And so we actually have an employee antibody study where we enrolled employees over an 8-week period. About 550 employees so far have enrolled, and we're going to follow their antibody testing for a period of a year. So we're going to get a second antibody testing in 3 months from now for those employees, or 3 months from their initial draw, and then 6 months, and then a year later, to kind of understand the dynamics of the antibodies, as well as how things have evolved over time for them. There's also a very large research study that multiple investigators at the Farber have engaged in and just recently opened for patients with cancer that developed COVID, to really understand how COVID impacted their cancer, how they did with COVID. And so there's a lot of sort of blood samples being drawn and different samples to really understand how COVID affects cancer patients. And so that there's a large number of faculty and staff who are engaged in that project. Overall, because of a lot of the safety measures that were taken, there were fortunately, I would think, Dana-Farber has 5,000 total employees. 75 have tested positive for COVID. Probably the vast majority of them were not actually exposures at the Farber or at the hospital. It's impossible to know for sure, but most of those are, and that number has really very minimally increased over the past 2 months. About every 2 or 3 weeks, there's like one additional positive case, and not all those were even symptomatic. About 400, a little over 400 patients that we're aware of developed COVID. Currently, there's only 2 inpatients from the Dana-Farber at the Brigham and Women's Hospital that are COVID positive. Again, I think a lot of the safety measures that were taking place really early on has hopefully kept in control for our patients as well as our staff and faculty. The importance of efforts like this, the Jimmy Fund Walk and the other fundraising efforts, can't be sort of underestimated. I think people probably have heard about the impact of the virus on hospitals, and the Dana-Farber is no exception. There's been, unfortunately, a significant loss in revenue that really does impact important patient services as well as research efforts that are ongoing. Again, there's a commitment from leadership at the Farber to really continue the services that we provide for patients and really to continue the important research that's being done. There is, some adjustments that have had to be made financially. There was an adjustment in being able to open Chestnut Hill, which we think is going to be a really important clinical space for us to be able to care for patients. The current opening is now delayed until mid-January. And that's where the really importance of philanthropy is. There's, in addition to the loss of revenue, just on the clinical side, there's certain research foundations that have had to make adjustments in terms of grants given for research. Particularly, a lot of the foundations have had to reduce commitments because of the current financial situation. So really, these type of dollars are so important to the Dana-Farber, both for our clinical care and research for patients. So that I really appreciate we all really appreciate everyone's willingness to continue to think about this a little different this year, but I think still could really have a successful and meaningful experience with the walk. I walked for the last 8 years on Team GI, which you also see in that picture right there. I have done it different ways each year, actually. For several years, I would walk with one of my kids. So each of my kids, who are now 15 and 17, have done the walk with me. We did those sometimes a little shorter walks, either 3 miles or 6 miles. The last several years, I've done the half marathon, 13 miles, with other people that I work with in the GI Cancer Center. We've had a team of about 50 people, somewhere between 30 and 50 people over the past several years. So it's been a really great experience, and it's really inspiring walking with others and sort of everyone with the same commitment. This was actually the first year I was supposed to do the PMC as well as the walk, since my wife is a biker and she's done it for 15 years, and my older son wanted to do it this year, and we were all going to do it, and we're also going to sort of reimagine how that's going to look for us in the next several weeks, in addition to thinking of a different way or the Jimmy Fund Your Way this year. So those were the comments I was going to talk about, Zach. And again, I really appreciate everyone getting on this call and their commitment to the Farber and to the Jimmy Fund Walk. And hope everyone's staying safe and healthy and enjoying the rest of the summer. Again, a reimagined summer for everyone this year. Thanks, Zach.
Thank you very much, Dr. Meyerhart. I think we kind of all reciprocate that, reciprocate that back to you as well, in our thanks for all that you do and all that your colleagues continue to do, and certainly these uncertain times, and something that we're certainly were unexpected. So we continue to look for you all for leadership within Dana-Farber, and we look to support you all in your research and the research of Dana-Farber however we can with events like the walk. So before we dive into our Jimmy Fund new app and Charity Miles, I want to give a couple of quick walk updates. We have, many of you are probably familiar with our normal Pacesetter event series, and we always have one in June, typically June, at Fenway Park, where we invite our first 100 Pacesetters to bring a guest. You enjoy a program, dinner, and the Red Sox game. Obviously, we're not able to do that this year, though it is nice that the Red Sox season is kicking off tomorrow evening, I believe. But we did want to obviously recognize the importance of the Pacesetter event. So we have gone virtual with our summer Pacesetter event for a cooking demo with celebrity chef Chris Nerschel. So we're actually increasing it this year. So the first 200 Pacesetters are going to be invited, and they will receive a $50 Stop and Shop gift card to make purchases for the ingredients needed as a part of this cooking demonstration. And we're really excited, and a big thank you to Stop and Shop and SBLI both for stepping up and sponsoring this summer Pacesetter event, which will be held on Thursday, August 20th at 5:30. So you'll get some more information, those of you that are Pacesetters. You'll get some more information over email in the coming days and weeks. And we still have spots available. We're not quite at 200 Pacesetters yet. So encourage all of you to, if it's something you're interested, or just, of course, interested in being a Pacesetter, to get there as quickly as you can. And we're, of course, here to help you as best we can. We want to give a quick update on our recognition program. Anyone that is an alumni walker has seen this in the past, that we have a kind of a rewards program for achieving anything above your fundraising minimum or levels as you go up above the minimum. So this is just a quick highlight of the items that are going to be available this year. This program was actually going to have an introductory email that goes out today, and then will be rolled out, in subsequent weeks, and you'll get reminders at each fundraising threshold that you cross along the way. So you can see you have a hand sanitizer here, and anybody that raises 300 or more is eligible to redeem, all the way up to our beverage cooler at our highest 5-star Pacesetter level at $5,000. And of course, you remember this year, the Pacesetter levels have changed to 1,000, 2,000, 3,000, 4,000, and 5,000. So you will get an email on this program today. Included in that will be a copy of this form, so you'll see it. You'll have it in your inbox later today. Last thing I want to talk about is just our T-shirts, and this is something that we've really never done before, but as you know, we are offering T-shirts this year to our first 5,000 walkers. So all of you that are on this Zoom today will get one of these t-shirts. And we wanted to just give a quick sneak peek as what the t-shirt will look like. We had promised it would be different. It would be more commemorative to kind of the world that we're living in right now. So we just want to show it here on the screen. It's probably a little hard to read exactly what's on there on the screen, but there is, of course, a footprint, a heart, a globe, and a ribbon, and under it, correspondingly with the words and colors, says, "Walk together wherever against cancer." And I think that really kind of defines our spirit this year in the virtual setting, and that we're all obviously still in this thing together, and we're still fighting for our patients at Dana-Farber and for research advancements that Dr. Meyerhart and others have spoken to you about over the last 3 months on our virtual town halls. So the shipments for these shirts are going to be a little different this year. I will say that. In the past, we've given an opportunity for team captains to get bulk t-shirts to distribute to their teams prior to the walk to help kind of save costs on shipping and things of that nature, in an effort to limit gatherings and people getting together to do those types of things. This year, everybody who is registered in time will receive their t-shirt individually in the mail. And that will come sometime in the week or 2 weeks or so prior to the walk. So we'll send out notifications when shirts have been mailed out, but you can expect that along with your bib and your medal and any other appropriate walk day swag, merchandise, anything else that you may need for walk day will be mailed out in that time frame. So just wanted to make sure everybody was aware of that. I know that a lot of teams customize their walk shirts, and the timing is a little different and is revised a little bit, but we're really trying to be creative as best we can to allow shirts to be in people's hands for enough time to customize if need be. But also, of course, understanding that this year is a little bit different. So we're really excited to spend the rest of the time today talking a little bit about our new app in Charity Miles. Hopefully you saw the email last week where we announced it and potentially have had some time to download the app, test it out, and get a little bit more comfortable using it, but we're going to try and help out as best we can today. I know I've started to use it a lot more, and the first day I was very confused, and I had seen it a lot in testing, and now every day I get more and more comfortable with it, and to the point now where I'm actually really, really comfortable using it and really enjoying tracking my steps, and it's given myself and my daughter, my wife, and pushing our baby's son in a stroller, some nice, kind of fun family time to do our walks while training for the Jimmy Fun Walk, which is actually nice this year that I get to I'll be with them on walk day. So it's a small win for the situation we're in. But I'm going to turn it over to Jess Hogan now. Many of you know Jess. Jess has been the behind the scenes for a lot of these Zooms, so she's coming front and center for us today. She's going to go over the app in general, and then we will be back to wrap up and answer some questions. So I'm turning it over to Jess now.
Awesome. Thanks, Zach. And thank you all, 106 of you who are joining today. It's been so great to get together this summer virtually, and we're planning to do it the next few months leading up to Walk Day. So thank you again for your ongoing support. Before we dive into the specifics of the app and how to use it, I think it's important to give a little background as to why we got this new app. So many of you who have walked before know that we have had an app in the past, and so you may be wondering, why do you have a new app? And so when we made the decision to hold the virtual event, we felt it was so important to bring the strong sense of community, inspiration, and connection that you normally experience on Walk Day to our walkers in this virtual environment. We can't build off each other's energy. We can't see our heroes. We can't connect with walkers we see every year. So really the sense and the need of community is greater this year than ever. And that is what we love about this Charity Miles app, is that it does just that. So all summer long, we're going to be pushing out Dana-Farber and Jimmy Fund content through the app. And it also seamlessly allows you to track your exercise. So whether you're walking, running, or biking, you can, to help you train, you can track that through the app and then easily post on social media to get donations. And as Zach kind of alluded to, as with anything, there's a learning curve, but we're here to help you with that. The more you use it, the more comfortable you'll get, and we're really excited to help you with that. So if you're looking for a one-on-one demo, our staff is always willing to help with that. So please don't hesitate to reach out. So Hopefully you guys had the time to download the app prior to this town hall. If not, you simply need to search in the App Store or the Google Play Store for Charity Miles. And I do just want to note that a lot of these screenshots are from an iPhone, as that's what I have. But if you guys have an Android and you have questions, feel free to ask us. The Charity Miles support team has also been really great in helping field those questions, so they're there to assist you as well. So once you download the app, you will be, and you install it, you'll be brought to this screen. And so you'll be prompted with this question, are you a new or returning user? I do just want to point out here that this is referring to a new or returning user for Charity Miles. This is not your Jimmy Fun Walk login. So if you've never used Charity Miles before, you'd be a new user here. I think that's just important and helpful to point out here. So once you say yes, new user, create your username, you'll be prompted to select your charity. We have our logo in here. It's easy to find. Simply scroll down and click it, or you can search, which is shown here on the right, for Jimmy Fun Walk. You'll be asked to confirm that that is the correct charity. So once you get from there, you'll be, as the app is configuring, you'll be asked to allow Charity Miles to access your health app. And if you're comfortable doing so, we absolutely recommend that you do that, as that is really how you're going to track your activity. You can see here on the right-hand side, this is your home screen, and this is where your steps and your activity will be tracked. One thing that I think is helpful to note is that the Charity Miles app pulls data from the health app in the iPhone. So if you notice maybe your numbers and your home screen maybe look a little different than what's in your health app, it pulls from the health app every night, so it should be corrected in the morning. If you're noticing something looks off, please just reach out. So once you're downloaded, you've allowed the health app to access it, this is your navigation bar. So we're just gonna walk you through briefly how to navigate around your app. This symbol right here on the left, this is your home page. So you saw a screenshot of it earlier. This is where your steps are counted. There also is a feature here to solicit donations through a Get Pledges button that Zach is gonna talk about a little bit later. This symbol right here is your content hub. So when I referenced earlier, we're going to be pushing out great Dana-Farber and Jimmy Fun content all summer long. This is one of the places you can find it. So you can find updates, you can find podcasts, and a lot more content living here. This center button, this is your activity tracker. So when you go out to do your walk, this is where you'll start tracking it. Additionally here, you can swipe up for more content. So we'll have different weekly challenges, impactful patient stories, videos, and more. So this is another resource you have to get some Dana-Farber content. This symbol right here, this is the team feature. So from here, you can join the overarching Jimmy Fun Walk group, and you can also start your own team and invite friends and family to join it and help see where they're tracking, how they're doing with their training miles. I do just want to note that we are waiting on an update to come through from the App Store. So the Teams section isn't fully updated yet. It should be any day. And once it is, we'll be sure to send out an updated user guide so you guys can know how to use this a little bit better. But once it is updated, we're really excited for this because you'll be able to see, if you do create a team, you'll be able to see the leaderboard. So you'll be able to see how people are tracking, how they're doing with their training walks. And if you're a little competitive, this may be right up your alley. You'll be able to see who's logging more miles. And it also helps with that sense of community. This last button right here, this is your activity history. So this is where you can see all of your past walks and your activity stats. All right, so logging your exercise. As I mentioned, this center button right here, this is where you will click to begin your workout. Once you click it, you'll see, as shown here on the right, you're prompted to choose your activity type. Indoor walk, outdoor walk, so on and so forth. One thing I want to note that is if you notice that you're trying to do an exercise that's not here, Charity Miles recommends that you select the exercise that is most similar. So if you're doing the elliptical at the gym, probably indoor walk or indoor run would be your best opportunity. Also, I do just want to say that if you track your exercise through Apple Watch or through the Strava app, those are also already integrated with the health app. So as mentioned before, Charity Miles will be pulling from there. So if you're playing tennis and your Apple Watch is tracking that, Charity Miles will be pulling from that each night. So it is really integrated and it's helping track every step. So once you click your exercise, you're brought here, and this is the screen that's going to show when you're logging your exercise. I mentioned before, you'll also have the opportunity to swipe up and to see latest, Jimmy Fun Walk promotions, challenges, other patient stories. That's where you can find it from here. And one thing that I think is worth noting is that when you're tracking your exercise, you don't need to leave your phone unlocked. You can lock it, put it in your phone, put it in your bag. It doesn't have to be unlocked while you're doing it. Also, one other thing to note is that in order for it to be counted as a unique workout, you do need to track at least 0.1 miles. So if you've been testing it out and maybe you haven't tracked 0.1 miles and you're noticing it's not appearing in your activity tracker, that's because it does require 0.1 to at least track it. So once you're finished, just click the finish button there to signify that you are done. Once you do that, you'll be brought to this screen. So this is where it's easily integrated with sharing on social to help get donations. So this screen on the left, this is what you're going to see as soon as you confirm that you are done with your workout. This photo is the stock photo, but we really encourage you to either snap a photo post-workout or choose something from your camera roll. You can see here our colleague Sam and her dog Bailey customized her photo and shared after her training walk. So once you do that, this is again still that same photo that Sam customized. If you were looking to share on Facebook, for example, you simply click the Facebook button and then you're brought here to the screenshot on the right that allows you to customize your post. We'd really encourage you to put a few sentences on why you're walking, what the walk means this year, how maybe you're walking your way. Another thing we do really want to encourage people to do is to include your Jimmy Fun Walk link in all of your social posts. It's just if you're posting and you're sharing your walk and you're sharing why you walk, make it as easy as possible for your donors to simply click on your link and go to your page and give. However, I do want to note that the app does have a pledge functionality that you are able to ask for pledges directly from the app. So I'm going to actually turn it back over to Zach and he's going to walk through that.
Great, thank you, Jess. So, the app itself really has a few main functions, but one, of course, is logging your miles and posting to social and all the things that Jess just talked about. Where the fundraising part of it kicks in is being able to ask for pledges from family, friends, colleagues, whomever. So when the way to do that, and this portion is a pledge-based methodology. It's not necessarily aimed at somebody making a straight out gift of X dollars, right? It is based on activity and pledging of your activity within the app itself. So to do so, you'd be in your homepage here. You can see on the picture on the left, and you click on the green button that says Get Pledges. From there, you simply want to fill out, and it's a sliding scroll on your phone, the 3 questions of what is your goal for your total campaign. So from now until whenever you want to end this fundraising campaign, which for me, for example, I put October 4th. That's walk day, right? So how many miles do you want to try and walk or walk, run, bike, participate in between now and then? So that includes training, walk day, everything that you're doing. How much is the average pledge amount per mile, right? So is it $1 a mile? This one on the example here is 25 cents a mile. I think I did 50 cents a mile on mine. So there's a lot of different ways in it, and you can just slide you right across the phone, and it adds up or decreases as you go. And then it wants to know how many pledges is your goal. And this is basically just to give you a math equation to show you how much you can raise by doing it. It's not a requirement. It's not listed on your fundraising page as your minimum. It's strictly in the app as to what your goal is to raise through the app. So I want to make sure that's very clear. And it is, it will go into your fundraising page, but it is independent of the fundraising pages that you currently have. Okay. Jess can go to the next slide. One thing to keep in mind is once you set your pledge goal, you cannot change it. Okay. The reason that you can't change it is, let's say, for example, you set it at 25 cents a mile and it's 100 miles and somebody's going to give you $25. And then you decide, hey, you know what? I want to do 200 miles. Well, now that person's pledge has actually increased by double and they don't know it, right? So you kind of have to be very careful on that. The only thing that you can change is the end date to when your pledge drive is going to end, okay? You also, once you fill out all that information and you click continue, it will bring you to the picture you kind of see here on the right. It will bring you, it brings you back to your home page. Then on the top right of that page, there's a little settings button. You would want to click on that, okay? And it will bring you to your pledge details where you can see the little pencil there in the top right of the screen on the left, and that's how you would edit that pledge page. So the thing that you want to do on that is the personal donation link in the middle there. You want to make sure you're hitting that, because that means if you have included that as Jess has done below, when somebody makes a pledge to you, it will automatically redirect to your fundraising page. So somebody makes a pledge, they will get redirected instantaneously to your page so that they can make good on that pledge and make your donation, okay? If they choose to say, and it should be noted that while it's pledge-based, many people, I think you guys would know this, they're not going to make a pledge to give you a certain amount of money and then be like, oh, well, Jess, you only walked 70 miles of your 100-mile pledge. I'm not giving you the full amount of my pledge. For the most part, you have to imagine people are going to make that contribution regardless. So then they will get directed to do it immediately. If for some reason they choose not to do it, they don't have to make a gift at that point. When your program ends or when you hit your miles goal, whichever comes first, they will be triggered in email to say, Jess reached her goal, you made a pledge. If you haven't made your gift now, go to this link and make your gift. And that will also be your donation link, okay? So it is very important that you do put in your personal link. If you don't, it's gonna take them to a search functionality page in the website where they can search for your name, but in a way to make it as clean as possible for the donor, we recommend obviously that you can get them to your page as fast as possible. If you don't know how to find your walk URL page, your fundraising page, please email our help box at jimmyfunwalk@dfci.harvard.edu and we can send that directly to you. We can edit it, we can change it to whatever you want it to be. We work with you on all of that, okay? And again, as Jess had mentioned, you recommend whenever you're sharing training walks on social or anything about anything you're doing really on social regarding the walk, you should be including that link on there. And then at the just really quick, Jesse, you just go back for a quick second. The green on the bottom right there, the view pledge page, it just gives you an opportunity to look at what your pledge page looks like. You can see how it looks in real time, and you can then go back and edit it if you don't like the way something looks. You want to change the photo, so on and so forth. Okay. We have a couple of challenges for the next couple of months within the app. We obviously want you to continue to train and stay fit and log these miles. So any walker that logs at least 75 miles on the new walk app and charity miles by September 1st will receive a Jimmy Fun hat. And as you know, we're not doing walk hats this year and set for first-time walkers. So this is it's a Jimmy Fun hat, not necessarily a Jimmy Fun walk hat. So we'll offer that to anybody that can log at least 75 miles. And the top 5 people who log the most individual workouts. So as Jess mentioned, that would be a workout of at least 1/10 of a mile, right? That's what it is, the kind of minimum requirement to log. Will receive a Jimmy Fun Walk swag box. And that'll be, and I should say that we're really excited that this challenge is sponsored by our friends at UFOS, who make very, very comfortable recovery footwear. So those wonderful folks at UFOS have offered a pair of UFOS to go in that swag box, and then we will have some additional things added in there as well that are Jimmy Fun Walk related that we're still putting the finishing touches on, so we won't give that completely away quite yet. So we're excited about our Summer Steps Challenge. If you have any questions at all with the app, this is really important. Yes, we're here to help you, and the walk staff is here to do anything we can. But for tech questions regarding the app, and I noticed that there was a quick question about it crashing on that I noticed on the Q&A page. Email support@charitymiles.org is the best way to get your answers fastest, okay? They will get back to you within 24 hours. If we get a question about tech, we'll, of course, do our best to troubleshoot it. More than likely, because it is not our app, we are going to be sending that question to Charity Miles ourselves. So this is a way to cut out the middleman, so to speak. So we encourage you to go directly to support@charitymiles.org for those questions. They're going to probably want to know what kind of device you have, if it's an iPhone, if it's an Android, what type of Android, all those types of things. And then for, of course, questions on the walk fundraising page or anything that you need, reach out to us at jimmyfunwalk@dfci.harvard.edu or your walk contact directly. All right. I Jess, I know how much time we have. Looks like we have a few minutes. If there's some questions, if you want to read through, I know we had some questions initially prior to today that have come through the inbox, but why don't we get through as many as we can?
Sure, yeah. So the first question we received, and we received this a few times, so regarding the app, the question is, will the app be based on GPS movement, or is it something I could pair with my Apple Watch or Strava? Zach, I know I touched upon that a little earlier, but do you want to elaborate a little bit more?
Sure. So the Charity Miles app uses your phone's kind of internal pedometer to track GPS, and GPS to track your distance. So on the iPhone, it will sync directly with your Apple Health app to pull all the steps and miles that you record on your phone. So this means that any fitness tracking device that you have attached to your Apple Health app, which Jess mentioned Strava and things like that, those are Peloton, Fitbit, those things are going to log in or going to connect through your health app. And I apologize, I'm one of the few, I get made fun of on the team all the time. I have an Android, so mine's a little different. But for Android phones, it will sync with your internal pedometer as well. But there are a lot of different Android operating systems, so it's hard to blanketly say like this one's going to affect everything, in this one particular way. So, however, as I've told my team, the most popular phone in the world is an Android, or operating system in the world is an Android. So there are probably many of you that have it as well. So, but it will connect directly to your activities.
The next question we got, Zach, was inquiring about posters for this year's Jimmy Fun Walk.
Yes. So we're planning on having hero posters available, actually. We typically have seen our hero posters along the route, and a lot of people tap them as they're walking. But we are going to have them available to download, and so you can print at home if you want to include them in your walk day experience. We have some more on that, and we're also encourage you to really check out the revamped hero portion of our website, because as you know, they serve such a motivating and inspirational factor to our walk, and we want to make sure that they are recognized and continue to inspire us the way they do every year. So it's a big part of what we're going to be doing. We've revamped a little bit of it. There's going to be stories and slideshows on the heroes as we get closer to the walk, and then we'll have that poster option available for download.
And so I think we might have time for this one last question, Zach. So this question was, is there a way for walkers to know if there are others doing a walk in their neighborhood or town?
Yeah. I'll be honest, this is kind of one of them that we struggle a little bit with, right? We understand that everybody wants to be enjoy that walk experience the way that they normally do, right? And seeing people all around you walking, and it's like, hey, well, if we can get 3 or 4 teams, we can build up this really cool walk, in our town or something like that. And we're struggling with that because, quite honestly, we want to follow local health guidelines as best as we possibly can, right? And so while we want to encourage folks to walk with family and those that are in their kind of circle that they've been with in quarantine, we don't necessarily, we're not going to be proactively telling people like, hey, there's going to be a large group of people that are walking here, because that really then kind of stifles the effort that we're trying to do by not having the walk in person itself. So I know that's not, the best answer, but we really are encouraging physical distancing as best we possibly can. And that is one of the main reasons, that is the main reason, health and safety of all of our walkers, as to why we're doing that. So if safety protocols are being followed and you're walking with your teams and folks that you know, and you're able to physically distance, of course we would encourage that, but we also don't want 200 people all walking together down the roads, and that would kind of course take away a little bit of what we've done. But as we get closer to walk day, as guidelines change, there may be updates to that, but I don't anticipate us sending out a list of saying like, so-and-so are walking here, go out and join them. I think that would kind of go against what we're trying to do.
We did get a few other questions, Zach, but just because we're tight on time, we'll include them in the follow-up email that'll be going out tomorrow.
Okay. I did see just one quick as I'm looking here. Can you bypass the app and raise funds the way we have in the past? Absolutely. Yes. I don't want to stress that enough. We want people to use the app, especially for like tracking activity and things like that. but your fundraising page is still meant to be your primary driver of gifts, right? You still want to send emails, you still want to post to social, you still want to text people your link. The things that you always have done should not change. This is a supplemental fundraising piece to what you're doing currently, okay? It is primarily an activity and engagement tool that has fundraising capabilities that we think can be very successful, but those should be supplemental in your efforts, okay? So I want to make sure I'm stressing that as well. And you'll know that the challenges that we've had have not necessarily been based on raise this money through pledges on the app, right? It's all activity based, and meant to engage our community together, and then hopefully then to drive folks to be bigger and better fundraisers through traditional methods with this as a supplemental piece. So I just want to make sure I did see that question. And I know there are a few others. We will absolutely email all the answers to these questions in our follow-up email, either later today or tomorrow. So just want to make sure I do that. I know we're a couple of minutes over. I want to thank Dr. Meyerhart again for joining us today. I want to thank all of you for joining us today. We really are only one big walk community, and we're in this thing together. I know it's cliche because you hear it so many times about, we're in this together, but we really, really are. And we're driven by one common goal for the betterment of the patients and families at Dana-Farber. And you're taking the initiative and sticking with us through these times and walking your way, and all of those things that we continue to push. We cannot thank you enough for that. And, yes, we're talking about the app and all these fun, exciting things, but at the core of it, it's your dedication and your passion for Dana-Farber that will drive the success of this walk. So continue to tell your friends, continue to get people to walk their way. We have our 50 states challenge. If you know somebody in a kind of obscure place and you think they want to walk, and hey, help us click a state off the list. And that is going to be, we have a nice map on the website showing what states we still need. But just continue to share the word and spread the love and the efforts of the Jimmy Fund Walk and your efforts as well. We're so thankful. Thank you so much. We will be back in August with another town hall. Hope all of you can join us then. And please look out for the follow-up email with the answers to the rest of those questions. So until then, signing off, but we're always available should you need us, and just don't hesitate to reach out. So have a great day, and thanks again.